Let me get back to my script.
I'm going to unmute the phone and we are starting OBS.
Okay. All right. I'm supposed to bang a gavel. I don't have that, so I'm going to bang my coffee cup and welcome everybody to.
Julie, hold on just a second.
Okay.
You are ready.
Okay, so I can keep going. All right. So good morning, everyone. I'm Julie Mayfield. I'm chair of the Housing and Community Development Committee, and I'd like to welcome you to our July 21st meeting. This is, I think, the first time we've met since probably February, and we are happy to be back and doing the work of the city in these important areas. This meeting is being held virtually. All of our council members and staff are participating virtually, and just because of that, and we're going to be pulling people in and out of the meeting for presentations. So we just we'll ask for your patience as we deal with the technology here. So I will, if people are following along, the agenda should be on the city's website, but I will be sort of narrating it as we go along as well. So just a couple of ways that people can engage with us and watch this. We are streaming live on our virtual hub.
This call is being recorded. You've been removed from this call.
And so, Brenda, what do we need to do about that? Is that people?
Julie, just keep going. I'm working on it. Thank you. Sorry.
That's okay. That's all right. So we are streaming live on our virtual engagement hub, which is accessible through the virtual engagement hub link on the front page of the city's website. We also have an option for the public to listen live by phone by dialing 855-925-2801 and entering the code 9791. I'm going to give you those numbers again. 855-925-2801 and entering the code 9791. And again, just welcome to everyone who is with us today. For today's meeting, we have the option for people to call in and offer comment during the meeting. We actually only have one public comment period today for this meeting, and that is at the end of the meeting. But these are the directions if you would like to do that. This does not apply to the people who are going to be presenting to us today. This is the public who's going to be calling, who might want to call in and offer comment. So again, to do that at the end of the meeting, you use the same phone number, 855-925-2801, and the meeting code 9791. When you dial that number, your phone will be muted and you will hear the meeting. At that point, you will hear a recording that says, for more options, please press star. If you press star, that will allow you to continue to listen and also join a speaker queue. And again, you should only do that and join the speaker queue at the beginning of the public comment period, which will be in this meeting only at the end of the meeting. If you're watching the meeting through the live stream while you are listening to the meeting by phone, please be sure to turn down the volume on your device. Okay, so I will now go through and introduce all the committee members and staff who are participating virtually. Please make sure to mute your microphone if you're not speaking. When you would like to speak, please unmute your microphone and remember to mute your microphone after speaking. So council and staff, as I call your name, please say a quick hello. Councilwoman Shanika Smith.
Hello.
Councilman Keith Young.
Hello.
Assistant City Manager Kathy Ball. Kathy, you're unmuted, but did you say hello? Is Kathy frozen? She looks frozen. All right, I'm gonna, maybe while she's getting unfrozen, I'm gonna go.
Good morning.
Oh, there she is, great. Super, thank you. And Paul, I'm gonna ask you to introduce yourself.
Good morning.
Okay, great, thank you, Kathy. Glad you're unfrozen.
Thanks, Julie. Paul D'Angelo here with Community Development, and we've got several members of the Community Development team on the line. Brian Husky, Emily Ball, who will be doing our homeless presentation. Emily will be joining a little bit later, though. We also have Jonathan Jones, Megan Gaskell, Nancy Williams, and I feel I'm forgetting somebody, but every member of our team is here this morning. Thanks, Julie. And thank you quickly to the applicants. If they can join us at 10:30, if they're listening, that would be great when we start the application 3-minute discussion.
Okay, super. All right, if there's nothing else, then we will just dive into the agenda. Is that good? Anybody have any questions before we do that? All right, so we're going to start with the agenda. And again, this is on the city's website, and if you would like to follow along. So the first thing is there a motion to accept the, where am I going? Is there a motion to approve the minutes, or are there any changes to the minutes?
I'll make a motion to approve the minutes.
Second.
All right, so we have a motion and a second, and as everybody knows we have to do, we'll do a roll call vote to approve the minutes. So when I say your name, please say aye. Councilwoman Smith.
Aye.
Councilman Young.
Aye.
Myself, aye. So the minutes are approved. All right, next we have Community Development Department updates from Program Director Paul D'Angelo. And as everyone knows, this is a written report, primarily a written report that we get that includes updates, lots of things. And I have a few questions about a number of the things, but Paul, is there anything that you would like to share with us before, anything that's in addition to the written report that we got?
No, Julie, and thank you. We did take the opportunity, community development staff, to kind of enhance this update just so that you all get a clear picture of what's been happening in the last 3 to 4 months. And this is also a report that we're going to be utilizing our CAPE team to get back into the public. So a little bit of a better marketing effort on our terms to let everyone know what we're working on. So happy to answer any questions.
All right. Again, I've got some questions, but Keith or Shanika, do you have any questions?
Not at this time.
Okay. Well, maybe not hearing anything from either you or Keith, I'll dive in. Again, just a few questions, Paul. The ESG CV funding that the memo talks about, that we got $430,000 earlier this year, and we're expecting potentially $800,000 later this year. Can you tell us how we spent the 430 and what we're planning to spend the $800,000 on?
Sure, Julie, I'm going to ask Brian Husky to unmute and take that question, if that's okay.
Mm-hmm. Sure.
Yeah, so this special allocation of ESG CV dollars, we were allocated $430,000 in phase 1. We had applications for some emergency shelter operations and rapid rehousing and homelessness prevention with those dollars. We don't know when the additional $800,000 will be coming down. I suspect it'll be sometime later this summer, and we'll go through that same application process again. We did our local review of the applications we received, and those applications are now being reviewed at the state level. And I expect we'll get some announcements on what's been funded maybe sometime during the middle part of next week.
Okay. And this rapid rehousing funds, this is different from the CDBG funding that council voted on last week that is about moving people into housing.
Yes, we'll pull some of those resources to be sure, there's several eligible activities for ESG dollars. The most critical needs we have in the community are for shelter operations as well as rapid rehousing. But we'll pull those resources with CDBG, and hopefully we'll have sufficient resources for the rental assistance component of what we're going to need for an exit strategy from the Red Roof Inn. And I'll talk about that in more detail in my presentation.
Okay, great. Second question I have is, and Brian, this is going to be you as well. HIAC, the housing, HIAC. I know, can you just give us a quick update on what's happening with HIAC? I know that we had, that the current structure of HIAC is, we have some concerns about that might actually threaten our ability to seek federal funding. We were in conversations with the county about redoing HIAC. Where are we in that conversation?
So I think earlier this year we landed on having an ad hoc nominations committee convene whenever there are vacancies on the committee, and to try to really get the sectors represented that we need to have on that particular group. And so Meredith Schweitzer from Homeward Bound agreed to chair that committee, and then we'll confer with our counterparts at the county and make recommendations for candidates to go before City Council and County Commission. The committee hasn't met in several months, so we're scheduled to resume meeting virtually next Tuesday at noon.
Okay, all right. And do you have some level of confidence that will ultimately fix our structural problem?
I think it's a move in the right direction.
Great, super, thank you. Third question, there was a blurb and an update on opportunity zones in our written report, but there's really not a lot happening on opportunity zones, right, Paul?
That's correct. We still haven't seen any kind of development proposals that are kind of mixing opportunity zones necessarily with affordable housing, which has been kind of the ongoing issue with opportunity zones. I did hear that there was a meeting earlier this month in South Carolina with Tim Scott talking about possible changes or something forward about making that link a little bit better with other resources. But as of right now, we're still kind of at the same place.
Okay, all right. And then I think the last thing I want to do is there have been some staffing changes in community development, and just want to give you a chance to introduce those folks. Christina Harris, and I don't know if Emily has joined yet, but I'm not sure we've actually had a meeting since Emily has been part of the staff as well. So
I think she just snuck in, but Emily Ball will be joining the call closer to 10:30. She's on one of her calls with the HMIS folks this morning. And then Christina Harris is our new CD coordinator, and she is on the call. She has been a great addition to our team. Super happy to have her a part of our team right now. I don't know if she wants to unmute and say hi, but she's great.
It'd be great if you would, Christina.
Hi, this is Christina. Thank you.
Okay.
And even with the reverb introduction, that's great. So,
that was very exciting. All right, and then just the last note I want to make on these is if folks didn't pay attention and didn't read toward the end of the report, there is a little paragraph about the over $3 million that our community development department has pushed out the door in the last few months through a combination of CDBG, Home, Strategic Partnerships Fund, Emergency Services Grant, Housing Trust Fund, a whole host of things so the work, I guess the point I'm making is the work has been continuing. The staff has been very busy, doing a great job and pushing a lot of money out into our community around homelessness and housing issues. So just want to say thank you, Paul, to you and your staff.
thanks for that, Julie.
All right. So if there's nothing else on the community development updates, we will move on to homelessness to housing. And this is Brian and hopefully Emily when she is able to join us to talk to us a little bit about the barriers to housing and our homeless population.
Sure. Well, first of all, thank you for this opportunity to chat about this in detail this morning. I'm really grateful to have the opportunity to present to you. Early on in the coronavirus pandemic, we of course recognized that our homeless population was at risk, and in particular, our unsheltered homeless population. And that's because they have to frequent congregate settings, meal distribution sites, and shelters that we know place them at grave risk for contracting COVID-19 if they get exposed. And so that having them be able to access, appropriate social distancing was really important. And our unsheltered population in particular, we know that there is a prevalence of conditions recognized by the Centers for Disease Control that place them at great risk: chronic obstructive pulmonary disorders, asthma, several other conditions that really place them at risk. And this is of significant concern for our homeless population, because if they get sick, they're twice to as many as 4 times likely to require critical care, and 2 to 3 times more likely to die than other of the general population. So we responded by initially creating a congregate shelter setting at Harrah's Cherokee Center here in Asheville. And that was, to provide shelter options for unsheltered folks that had one or more of those CDC identified conditions. That operation started on April 8th. We transitioned that to the Red Roof Inn on May the 11th. And to date, between those 2 shelter operations, we've served 124 unduplicated folks, and the Red Roof Inn is currently supporting 66 people in 60 households out there. And another item of note is that with the 1,050 or 60 confirmed cases of COVID-19 here in Buncombe County, only 5 cases have occurred in our homeless population. And certainly there's a need for additional testing, but we're encouraged that we have been able to get people out of harm's way and see very little incidence of COVID-19 in our homeless population. I think the pandemic has kind of highlighted, issues around homelessness that we have all certainly thought of before, but more so now. Obviously it's a public health issue, and the way to best address it is through housing, because people who are homeless, if they get into housing, they can socially distance and isolate, just like all of us who are fortunate enough to have our own homes have done over the last 4 months. And if they have an opportunity to tend to their own health and hygiene, obviously this is a healthcare issue. Homelessness it's also an equity issue. In Asheville and Buncombe County, African American, Indigenous, and other people of color comprise 31% of the homeless population, compared to about 11 or 12% in our general population. So there's significant equity concerns that have really been obvious during this pandemic. And then, it's a housing issue. Homeward Bound is working on permanent housing options for all the shelter guests out there. 3/4 of them have a housing plan identified, and the rest of them are underway. And some of those plans involve, existing community resources, and we're going to need some additional resources. So while the costs of ending homelessness, and that's our objective, is to end homelessness and make it rare, brief, and non-recurring, obviously there's significant cost and resources needed to do this, but maintaining homelessness, it costs more. If we invest in the housing options that homeless folks need, ultimately it reduces the cost of things like emergency services, locking people up, hospitalizations, and it minimizes the need. If we house people, it minimizes the need for those types of crisis responses. And so we have thought a lot about this particular pandemic and the opportunities that it presents to really reduce the number of people who experience homelessness in our community. There's 4 components to this. Obviously we need housing units.
Hey, Brian,
Yeah.
I'm gonna interrupt you for 1 second.
Sure.
Your slides have not been advancing.
Yep. So Christina, could you go ahead and advance to the next slide, please? Yep, there we go. And you can go ahead and move on to the next slide. Great. So again, it's more cost effective to end homelessness than to maintain it. And you know, interventions like the temporary shelter we did at Harrah's and the Red Roof Inn, you know, these are obviously, you know, very costly options. To end homelessness, we basically need four components. Obviously, we need rental units. We need the rental assistance. We need the supportive services, and we need better data. So next slide, please. So again, you know, our hotel exit strategy for operations at the Red Roof Inn, again, there's 66 people and 60 households that are currently being sheltered out there. You know, the housing plans that have been developed for folks, it's a combination of income-based housing, project or tenant-based housing choice vouchers. VIA has been a good community partner with their TCLI program. That's a transition to independent living in the community. And so the housing cost and the rental assistance, there's a lot that's already available. Obviously, that COVID-19 money from the Community Development Block Grants is a resource, and this infusion of emergency solutions grant dollars is another resource. So, you know, we feel like you know, these four components. If you can move to the next slide, please. Okay, so the units again, you know, it's going to take a while to get people placed. You know, sometimes there's just not enough units available that will that can be obtained using the current fair market rents. Although our FMRs did go up here in Asheville, that certainly helps. Housing placement takes time. And if the FEMA funding that we're counting on to make us whole on the cost for the Red Roof Inn, if that were to be suspended, you know, frankly, it may be that some people return to homelessness for an interim period before we get them housed because it just takes time. There's really not any additional resources that we need around units, but it might be good to have some sort of community-wide call for landlords to step up and make units available to people experiencing homelessness as part of an overall community strategy to get us through this pandemic, get our unsheltered homeless population housed. So some sort of call to action might be helpful. As I mentioned already, the rental assistance is available in several different funding streams that are coming to us, housing choice vouchers, you know, VIA and other resources that are out there. Around the supportive services, this is where we really need some additional capacity. We need some permanent supportive housing case managers, and we need just a straight up housing case manager. And so these are to do the things that, you know, not only provide the long-term supportive services that people are going to need, but also just all the legwork that it takes to get somebody ready to move into housing, securing all the documentation, you know, getting household furnishings, you know, actually arranging the move-in, dealing with the landlord. It's a complex process and it takes time. And so our recommendation is that we need $275,000 over the next 2 years as seed funding to provide these two supportive housing case managers for 2 years, and the one housing case manager that would be doing a lot of the logistical stuff around our Red Roof Inn shelter occupants over the course of the next year. And Emily Ball, who joined our team back in January, she is you know, working with our homeless management information systems, our HMIS. And we think that HMIS should be required for any city-funded activity that is related to homelessness. And she's been great about getting agencies that have not participated in HMIS, getting them up to speed. So we've made a lot of progress on that. And I think we'll be in much better shape to have better community data by the end of this year.
Okay, and I think we need to be on the next slide, at least.
Yep. I think that may be the last of them.
All right.
Yep.
All right.
Yeah. So happy to entertain any particular questions that folks might have about all this. The resources that we really need pretty urgently are around those supportive services.
Questions from Keith and Shanika? Not surprisingly, I have some, but I'll let you guys dive in first.
I have a question about transportation. I know the bus line is further up Patton Avenue. So we've been partnering with Mountain Mobility to make sure that they get at least from Red Roof Inn to the first bus stop,
Yes.
I think at Goodwill. How is that partnership and how much has it cost us and how are we paying for that?
So there's not any cost on those transportation services. It's just, Mountain Mobility is just an extension, past that last bus stop outbound out there by Goodwill and DMV. So there's not been any transportation costs that we've incurred. That circuit runs about every hour. I can't remember how far out that circuit goes, and then comes back, an hour later. So it was a cause for concern early on, but I think it's been okay.
So Brian, you're just saying that's part of Mountain Mobility's regular route.
That's correct. Yes.
So there's nothing additional there.
No additional costs on that. I think there were some transportation costs that Homeward Bound incurred early on because, getting 66 people from downtown out there, I think they had to rent a van for a couple of days to get folks out there. So, but those are the only transportation costs that we've incurred.
And I'm just curious, a lot of our food sites are more in the city, and some of the people we've housed have had trouble getting into town. So have we been providing food and how is that supported?
Yes, so 3 meals daily have been provided out there. Homeward Bound worked in collaboration with the Asheville Poverty Initiative to do those 3 meals, and so 3 meals have been delivered out there to all 66 folks, and those are costs that will be covered by the FEMA reimbursement eventually. So Homeward Bound, we here at the city and Asheville Poverty Initiative, that's been a really great collaboration to make sure that people get fed nutritious meals out there.
And I have one more question, because I believe we were successful in housing some of the individuals there since they've been housed at Red Roof Inn. I wanted to know what made that so successful. I would dare to say that they've already been working on some housing goals.
Yes.
And just that first question, why was it so successful in this case? And is there a plan for the rest of the people who are staying here to find them some housing options?
So some of the people that had been sheltered out there, when they went in, they were already in the queue to be able to get into units. And so fortunately, that's just happened in some cases, through VIA's TCLI program and other community resources. So, when you're already in the queue and you're just waiting on an available unit, that makes it a lot easier. Kathy Ball and Tony McDowell and Sam and Paul and I and Emily are going to meet tomorrow to talk more specifically about what the exit strategy looks like. But again, right now, about 75% of the shelter occupants have a housing plan with an identified resource. We're working to figure out, plans for the other 25%. But to really expedite that, the commitment of resources around the supportive services is going to be really critical to making that move faster. So we do have rental assistance resources. Call to action around getting landlords to step up and make units available, and then a commitment for the supportive services. I think we have an opportunity here to get 66 people off the streets and into permanent housing. And, the circumstances have obviously not been ideal, but the opportunity is here. And I think the time is now to seize it.
Okay. Keith, any questions from you?
No questions for you.
All right, Brian, I've got a couple of questions. So getting to the funding pieces that you have laid out, you make the point that housing people is actually less expensive than not housing them.
Yes.
One of the issues is that, of course, different local governments bear the benefit and burden of that.
Yes.
It's the county government that saves on EMS and all of that. It's not the city. So are we talking to the county about helping support some of the positions that you have laid out, the 3 positions that you've talked about?
Have not had conversations with them yet. We wanted to get into the discussion with our core team here at the city tomorrow and figure out a strategy on what resources we might be able to request from the county.
Okay. I think we absolutely should do that. Again, they're the ones that reap the financial benefit for this population of people not being a burden on the emergency services system. So that would be great. And if you think me or any of us on the committee has a role to play in that, please let us know.
Yeah.
At the political level. And you said that there's no need for more rental assistance money now. And I understand that. How about a year from now? Are you anticipating that the city might need to be looking at some more maybe direct allocation from our general fund or from the Housing Trust Fund or something like that for rental assistance?
I mean, certainly those are resources that we might need to look at some point in the future. The Emergency Solutions Grant, COVID money that's coming down the pike, that can provide assistance for up to 2 years for people. One thing that would be really helpful related to the home consortium, if there could be consistently a carve out, a percentage of those funds, let's just say 25 or 30% for ongoing rental assistance, that would be really, really helpful. It would be a game changer for us. We operated for a long time under the assumption that the 2 years was the maximum for tenant-based rental assistance under home, but we recently got some guidance from our HUD field office that there's no limit to the number of 2-year periods that a particular household can use those funds for. So it was really a game changer for us to learn that. But getting an ongoing commitment of a certain percentage of those home dollars would be very, very helpful to sustaining this effort. And I think really the commitment of sustaining the supportive services is probably the most significant potential ongoing need that we might have. I don't want to speak for Homeward Bound, but I think that seed funding that's come from public sources, that they then look for other sources to sustain, that's worked for them. But if we really want to have the maximum impact, an ongoing commitment for those supportive services, which are the hardest to fund, would really make a big difference.
And are you gonna be proposing, or are you proposing essentially that be part of the city's fiscal year 2021 budget? Is that where it needs to happen?
That would be our recommendation. Certainly there's a lot of other voices that are going to have to weigh in with that. And again, tomorrow, Kathy and Tony and Sam and Paul and Emily and others and I are going to be meeting to talk about, what we need for a successful exit strategy for the occupants at the Red Roof Inn. But it's been really great that we have been able to keep those people safe and out of harm's way out there. But ultimately, as always, permanent housing is the solution to homelessness.
Right. That's right. Okay. Yeah. And again, let's be aggressive in talking to the county about all of this. And then my last question is around the data. So the recommendation is that, anybody who's getting funding from the city sort of participate in that HMIS system. Is that a requirement and a change that you can affect at the staff level, or do you need council to take action on that and make that a requirement of getting? That's just a procedural question. I think we can make it an obligation of the funding, but council action certainly wouldn't hurt to confirm it. So I would ask for that. Sure. Well, maybe y'all can talk about it. I mean, if you need council to say anybody who gets funding from the city on these issues must participate in this, if you need that stamp, then bring it to us. If y'all can do it at the staff level, then you can do it there. I just want to make sure that we're honoring your need and desire for that to happen.
Okay. Yeah. Thank you. We'll certainly look into it and make the ask if we need to. So.
Okay, great. All right. Any other questions that anybody has about that?
No questions.
Okay, great. Thank you so much, Brian. Really appreciate you and Emily and the rest of the staff. This has been a very challenging time, and you guys have done a huge lift with both first the Civic Center and the Red Roof Inn. And I just can't even imagine what your work days have been like trying to take care of these folks and keep them safe and get them the services they need. So,
well, I appreciate that. It's certainly been a lot of work. We're fortunate to have really great partners in the community and internally. There have been a lot of people who have helped us get contracts done, get questions answered. I mean, it's really just been a good team and community effort.
Right. And of course, Homeward Bound is our key partner in that effort. So
yeah, Access Security, the Asheville Poverty Initiative. I mean, it's really been just a great community effort all over. So certainly a lot of work on our part too, though. So thanks for that recognition.
Great, thank you, everyone. All right, we are going to dive into the meat of our meeting today, the CDBG allocations, and I will pitch it to Paul to present the staff recommended allocations for the block grant. So as folks know, we normally take a big old day to hear SPF presentations and applications in CDBG. We sort of do that all in one big, sometimes very painful day, painful for everyone. I think this year, because of COVID, we did it a little bit differently, and we asked the staff to make funding recommendations to us. As opposed to what they normally do, which is just present us the information. So we actually have all the applications and all the information. We also have the staff recommendations for funding, and Paul will present those. And then after Paul presents, we will be hearing from the applicants in small groups. Each applicant will have 3 minutes to talk, and we'll bring them in again in kind of groups of 3 or 4. So that's where the technology might get a little wonky. So we just ask for your patience. So Paul, go lead us in.
Thanks, Julie, and I appreciate that. And please know with the applicants that Christina and I will be working behind the scenes if somehow something gets tripped up to work to get somebody back online and able to do their 3-minute presentation. So regarding the CDBG funding this year, I think you all have the staff memo in front of you. I'll just briefly go over the evaluation criteria. When these applications came in for CDBG funding from HUD, Community Development Block Grant Funds, they were analyzed individually, in partnership, and then twice by the entire community development team, particularly looking at some of the evaluation criteria that you see in your memo. So we were, of course, looking for eligible activity and meeting a national objective. How did it align with our 5-year consolidated plan on high priorities? How's the organizational capacity and experience with federal funding? How are they handling past allocations and awards with timely project completion and capacity as an organization to achieve outcomes? Taking a look at their budget, are they leveraging other funds? Is it a reasonable budget? Is it a timely budget? Looking at those measurable outcomes, are we getting that return on investment, as they would say, but more importantly, impacting the lives of moderate and low-income individuals and families and moderate and low-income areas. Looking at duplication of services in the aspect, are there other organizations already doing this work? Is there a partnership opportunity there versus a new application? Always looking for clarity of application, and also addressing staff questions and concerns in our technical assistance. And then when you look at the funding, with what's happening this year with COVID, really taking a look at partners that were offering some type of housing assistance. As most people know, CD is concerned, as many people, that with the unemployment benefits ending basically the beginning of next week, we're really concerned about housing and rental assistance, both from a tenant and landlord's perspective, starting in August. So we really took a look at our partners who were focusing on housing and helping to get folks housed. So that's how we came up with our funding decisions. We always have limited funds. Unfortunately, we always wish we had additional funds, especially in public service. And in this year's application, you all have that funding recommendations in front of you, and I'm happy to answer any questions or provide any additional information you're looking for before we get into the 3-minute verbal presentations.
Paul, I would ask that you, before we dive into the presentations, maybe so you have recommended, the staff has recommended funding for most organizations, but not all. And if you could speak a little bit to the handful of groups that you haven't made recommendations for and help us understand staff's thinking on that. I know for some of them, they haven't necessarily maybe drawn down the money that they've been allocated. And so there's sort of money sitting there, but if you could help us with that, that would be great.
Absolutely. And so regarding the few agencies, I'll start with public services. Regarding the YWCA, we had about $15,000 to go between the two agencies. And what we thought might be easier, instead of having, and this would be up to the YWCA, instead of having two contracts, additional draw requests for each contract, would it be easier for YWCA to have one contract with us for one project or program, and then just follow those draw requests versus dividing that up between the two programs? And hopefully YWCA in their own can work with their budget so that just makes that process easier for them when it comes to the contracting, the draw requests, the outcomes. And so we thought that might be a good idea for the YWCA. Moving down to Elida Homes, again, limited dollars in public service. We did provide a small home funding grant, the other side of our HUD funding, to Elida, I think in the amount of $6,000 to $7,000 to Elida Homes. And they're a first kind of time applicant with us in this type of funding. So we did provide them with some home funding and did not recommend funding this year for their public service request. Regarding the Haywood Street congregation, excellent group like all of these are. We are working, as I think everyone knows, with a parcel, a city-owned parcel, to work with them to see about doing a 40-unit building of supportive housing and mixed income and affordable mixed income. So we are working on them. They were kind of a new applicant to our CDBG funding. We thought that the better avenue with our limited funding was to continue to work with them on the city-owned parcel. Riverfront Development Group, Catherine Mitchell, she is great. She emailed yesterday that she is pulling her application for this round of CDBG funding. And then working down a little bit to the Housing and Economic Development funding, the Community Land Trust, a great organization, really doing a great job of getting up and running. Again, I think most folks are aware that we've got $1 million set aside on bond funding for them, as well as looking at some directed housing trust fund dollars to assist them with administrative and staff costs. So knowing that there is potentially $1.1 million waiting in the wings with the ABCLT, we thought it was best that we would try to work that avenue for funding. And then last but not least is Eagle Market Street. Stephanie Twitty, a great partner with us, and Mountain BizWorks and Carolina Small Business for Opportunity Asheville. And those three organizations, as you know, kind of go together. With some previous funding that's still out there, about $30,000 in the 17-18 funds. I think we're expecting a draw request for about $10,000 to come in, so maybe $20,000 left, plus their 19-20 award of $81,000. We estimate about $100,000 to $110,000 that still will be going back into the community. So similar to what was done before, a little bit of a pause, and then let them spend down this money, and then work with them through the year, as we've been doing recently on a new project that they're proposing, which is really exciting, and then bring them back for future funding in next year's round. Those CDBG fundings, we try to get out timely and work with our partners always, and as Stephanie Groups is great, we look at that as a little bit of a pause. And then for you all to think about, this did leave us with a contingency, which means we had leftover funding in the non-public services category of about $184,711. So again, we analyzed those applications based on all those criteria in the staff memo. And then at the end, looking at that, we were like, wow, we've got about 185,000 left over. And we had to talk about that amongst the CD team, which was like, well, this could, depending on how all the funding goes, with the concern that CD has regarding rental assistance and the problems that could be happening with the stop and unemployment, this could be what we would call a middle goal here for having some additional funding to go towards some of these difficult issues we might be facing with COVID-19 as this issue drags on. Kind of an immediate short-term solution was the $615,000 that we got from HUD COVID. This additional 185 could be a round 2 funding that we could use in the community. If you also choose, that would come about in September, give or take, and we would get the funding from HUD when that happens with contracting. But it really could provide us with that next round 2 of getting funding back into the community for rental assistance. Hopefully that answers your questions, Julie, and happy to take any questions.
I do have another question about that contingency, the 184,711. Could that? So I hear what you're saying in terms of maybe a second round of rental assistance. Could it also go toward what Brian was just talking about in terms of expanding the supportive services around housing our homeless population?
As long as it was around CDBG eligible activities, it's kind of that opportunity for our homeless population, rental assistance, or anything else that might come up in these changing day-by-day times. As long as it was a CDBG eligible activity, we can do it.
Okay, so and that would be funding those staff positions would.
I believe so. Brian, did you want to add anything there?
Certainly that could be a source to fund those supportive services positions. The immediate concern would be, we get that money in 1 year increments, making sure that, there's adequate support and dollars carved out to support the second year of that. So, because we're under a lot of pressure from HUD to get those dollars out the door. So.
Correct.
Okay. Good. Keith and Shanika, any questions for Paul at this point before we jump into the presentations? Okay. All right. So again, now we are going to hear brief descriptions of each project from the applicants. As I mentioned earlier, each applicant will have 3 minutes to talk. We're going to bring them in small groups of 3 or 4 at a time, and I'll narrate and call on the different groups. I've got the order in which they're coming in. Applicants, please remember to mute your microphone as you come in, and when you're not presenting, unmute yourself when you are presenting. Please start by stating your name and the project, your organization before you begin. And then once you're finished and we've moved on, you can leave the meeting. And what's important about this, I want to say to the committee members, because these folks are going to be leaving the meeting after they present, any questions that we have for them, we need to ask them while we have them. So we need to, if we have questions for them, we need to ask them right when they finish their presentation. Otherwise, when we move on to the next group, they're going to be gone. So just a reminder for us, and I'll prompt us all on that as well. All right, so I will announce the names of the applicants in each group in order as we go through. And the first group is going to be Homeward Bound of Western North Carolina, On Track Financial, Pisgah Legal, and the Spark Foundation. So everybody cross your fingers. And somebody's going to tell me when these folks are actually in the meeting. Great. Is that Homeward Bound?
Yes. Hi, Julie. It's Curtis.
Great. You can go ahead. And Paul, I think Paul is timing. Is that correct?
Yes.
All right. Go ahead, Meredith.
Okay. Thank you. So this request is for our AHOPE coordinated entry process. This funding would go to support salary, benefits, and payroll taxes for one of our staff who would be directly implementing the coordinated entry program at AHOPE Day Center. Prior to COVID, we were seeing roughly 180 folks entering and accessing services at AHOPE. We are still seeing very large numbers. We still have an average of 120 individuals who are experiencing homelessness coming to AHOPE to get access to services. Of course, about 66 people who prior to COVID were coming to AHOPE are now being sheltered at the Red Roof Inn. So that's why we believe that we have seen a change in the numbers, but still 120 individuals accessing services in the time of COVID with practices to keep people safe has been just been a heavy lift, I will say. So this position would actually be to support providing all the support that these individuals need to get access to services, to get them to sign up for the processes that we have to get them into the system and get them ultimately accessing housing.
Okay. Any questions of Meredith from the committee?
No questions.
All right. Meredith, if we were to make this all or portion of this contingency funding available to Homeward Bound to hire some of those supportive services positions that Brian talked about earlier in his presentation, would that be okay with you?
Can you repeat the last part of your question, Julie?
Would that be all right with you? I mean, if there were money for Homeward Bound, or I suppose it could be another organization, but we already work very closely with you all. If there were funding available to hire some of those additional supportive services positions, is that something that you all could take on?
Yes, absolutely.
Okay, great. All right.
Councilwoman Mayfield, Brian Husky here. The coordinated entry is something that is required of us for the community for HUD funding. So just wanted to make folks aware of that.
That's right. No, yes, thank you, Brian. That's a good reminder. So what has been requested is sort of what we have to do.
Right.
And what I just mentioned would be lagniappe on top of that. So, okay. All right, great. Thank you, Meredith. And we'll move on to, and thank you for being brief, move on to On Track.
Thank you.
Thank you.
Good morning. This is Celeste Collins with On Track Financial Education and Counseling. Everybody hear me?
We can hear you and see you, Celeste. Thank you.
Excellent. You see my money manifest. Yes, thank you. I'm happy to be here. The project that I'm representing for On Track Financial Education and Counseling today is our Housing and Financial Capabilities Program. When we wrote the application back in February, it was well before the COVID pandemic, and the three areas of focus that we had in the application were home buying, credit building, and then money management, which is the financial counseling. About 60% of what we were projecting would be towards the money management and financial counseling aspects of our program. With the onset of COVID, we are seeing demand in a very different way than what we had originally projected. There are people that are engaging with our services for emergency cash flow planning. And earlier in the meeting, there was some discussion about the ending of the unemployment benefits and that type of thing. And we are poised to help people as they try to figure out what to do in those financial crisis situations. We have pivoted our in-person counseling services to provide services online. We have virtual counseling sessions available. And the good news is that of the people who have gotten screened and scheduled appointments, 93% of the folks are following through and showing up for those appointments. And so we feel really good about those, the show rate, essentially, that people are investing time in doing these types of services. So we're working to turn the faucet open up more and more types of programming to the community based on the needs and what we're hearing from clients. I'm pleased to report that for fiscal year 20, we met all of our outcomes and exceeded our projection in terms of number of clients seen. The types of services that we're providing right now, emergency cash flow counseling, foreclosure prevention, budgeting for reduction in income, and then dealing with debt and dealing with credit. We have shifted our in-person classes to webinars and are slowly and intentionally, deliberately expanding the number of webinars that we have available to meet people's needs. And also providing twice a week a resource digest that gives updates on unemployment benefits, foreclosure moratoriums, utility shut-off information to keep people abreast of the types of resources and assistance that are available in the community. And we very much appreciate this opportunity to present and happy to answer any questions.
Any questions from the committee?
My time is up.
That's not me.
Oh, it's not you. Okay. Well, whoever's alarm that is, maybe you could.
It's not me.
Okay. Hearing no questions from the committee. Thank you very much, Celeste. Appreciate all the work that you're doing to help folks in our community. And thank you. We will move on to Pisgah Legal.
Good morning, everyone. I am Robin Merrill, Managing Attorney at Pisgah Legal Services, and I'm really excited to see this committee meeting. I've missed you all because housing issues have certainly risen to the surface through the pandemic. So I'm glad to see you all getting together. And if we had known what was going to happen, we would have asked for a lot more money than we did. Our application is for $45,000 and the staff is recommending $28,000. And I respect that decision. I know that public services is the toughest category. But we also know that in July, a third of Americans didn't make their house payment. And the federal unemployment benefits are running out at the end of this month. So those numbers are projected to be higher for August. We know here in Asheville that some of the job types are not going to come back. And if they do, they're going to come back very slowly. And we know, we know that the most vulnerable among us are the ones who are most affected by the pandemic. And that's our children, our seniors, and our people of color, and our persons with disabilities. And so the result of that is that we can't have those people become homeless or get evicted. It's hard enough getting evicted in normal times, but in the middle of a pandemic, it exposes every person involved, not only to the illness, but to the consequences and long-term effects. You know, a low-income kid is probably already struggling to do remote learning. How do they do that when they're homeless? How do they do that when they're evicted? You know, maybe a mom who is really having to decide between staying at home with her kid or trying to get a few hours in at work. And then if she has a job and if she's concerned about whether she's going to get exposed in the job, I feel incredibly grateful and privileged that I'm not making those decisions myself. But the bottom line is we are facing an eviction crisis, and every resource that you can put toward it, we will use to the best of our abilities. Just an update, because I know that you all invest in our courthouse project. You know, we're no longer able to have a table outside the courtroom. What we are doing instead, with cooperation of the Clerk of Court's office, is that we are receiving the dockets and complaints in advance, and we are calling all of the people who are facing eviction to talk to them about their situation and seeing if they need or want our services. So we're doing what we can to continue to reach those people, and we'll keep doing that. But so thank you, and I'll answer any questions you have.
I've got a question, Robin. Your the outreach that you're doing now by calling people, what's the response rate? Are people grateful? Are people saying, yes, please help me? What are you hearing from people?
People are grateful. Some people are surprised and they had to kind of get past that, but people are grateful. A lot of people are taking our help. Some people think they have their situation worked out. Others are planning to move in with family or something like that.
Mm-hmm. Are you generally handling more cases now than you were with your table at the courthouse?
We are.
Okay. And remind me, if you can, how much, so just to remind everybody, in our SPF funding, we have sort of put that on hold a little bit, but we did pull out and identify 3 organizations that we shot money to preliminarily ahead of everybody else for specific reasons. Pisgah Legal was one of those, and it was to address this very issue. And remind me how much we gave you in that context.
$15,000.
Okay.
And I am assuming we won't receive that until you pass your budget.
You assume what?
That we won't receive those funds until you pass your budget.
Yes, but we are going to pass a budget in next Tuesday. So hopefully that those 3 allocations are in that budget, and we will be able to do that soon.
Thank you.
Other questions from the committee?
I can imagine that your staff is overwhelmed. I think I was talking to a constituent a few weeks ago, and they were preparing for court. And I think they referenced you all going outside the county to get other help from other legal support. Can you kind of give us an idea how that's going and what kind of partnerships you all are initiating to kind of help support the volume?
Yes, we have a robust volunteer attorney program, and we are doing weekly trainings with folks to train them up on landlord-tenant law. I personally am doing a lot of advocacy, including with the state, to try to get the state CDBG funding to be used for rental assistance. Quite honestly, I've just been very frustrated about the slowness of that process and the fact that the eviction moratorium ended, courts reopened, and there was not rental assistance in place to help people at that time. We are talking to families who are getting evicted. But yes, we are working on, building a network as large as we can to pull together all the resources we can. Julie, you're muted.
Yep, I saw that. Thanks. I've got 4 screens open. This is like the first time that I've needed multiple screens in front of me. I felt that need. Okay, any other questions for Robin? All right, thanks very much, Robin. Keep doing the great work that you're doing. We really appreciate it. And again, as I've said to you individually, if there's anything else that we can do from a policy perspective or anything else, please let us know. Obviously, money is the big thing today, but great, thank you. All right, and the next is the Spark Foundation.
Good morning, everyone. I'm Jackie Latek from the Spark Foundation. And while I don't have a cool background like Celeste, I do have a brick wall. That's what we've been all hitting our heads against since March. So there you go. But let me just get right to it. Changing Together consists of 2 certified peer support specialists who provide holistic case management services to under-resourced and overburdened communities. In order to connect with these communities and provide support, our case managers spend time in those communities. They attend food markets and other gatherings. They talk with their networks, and they respond to requests that come through word of mouth. While our focus is workforce development skills and sustainable employment, our case managers are often supporting individuals with obtaining other kinds of resources, such as housing, transportation, and health needs. The relationship between case managers and the individuals they serve is critical to overcoming barriers of mistrust and anxiety. We assess individuals to identify their strengths and needs, and together we prioritize and build a roadmap for their movement from crisis to stable, and then from stable to thriving. Our case managers have an established relationship with Craggy Correctional, who connects when a local resident is being released. Additionally, we continue to collaborate with My Daddy Taught Me That to provide prevention services to those young men. Tony Shivers is our full-time case manager who also runs a men's group where he offers his life experience in order to teach coping skills, practical life transition skills. Tony talks with his group members about perspective, goals, investment, and commitment. He tries to instill an entrepreneur mindset. We have a women's empowerment group serving women returning from prison and/or women living in marginalized communities. These referrals come from probation, SOAR court, and drug court. And our facilitator is a woman with life experience returning home from prison. She focuses her group on coping skills, addressing challenges specific to women and parents of color, builds those networks of support, provides resources, employment support, and is available for crisis support. Tony and Ronnie are both currently staying connected with their group members on a one-on-one basis during COVID. A little more about COVID. Certainly, we've seen a drop in individuals seeking employment since March, but there are folks who are looking for work, and this additional barrier with COVID really requires our case managers to be out there and available for them. As has been mentioned on this call, those extra unemployment benefits are going to end. And so I think we will start seeing an increase in need, and we will eventually recover from COVID. I'm not sure when, but we will. And we need to have our case managers in place when that time comes. So we'll continue to provide all the supports that we're doing now. Are you waving at me? Is my time up?
Your time is up, Jackie, and waving in general, but yes. But if you want to finish, I'm sure it's fine.
Okay. Lastly, Spark is engaged with the Chamber of Commerce in its Golden Leaf Award, which is a focus on economic opportunity and mobility in North Carolina. We are currently developing a process of connecting returning citizens to quality jobs with employers who are part of this partnership and who have committed to building an inclusive work environment. The city of Asheville is one of those employers, so thank you very much. But funding from CDBG and the city of Asheville will pay for case management services and those men's and women's empowerment groups. Thank you all very much.
All right, thank you, Jackie. Questions from the committee for Jackie? All right, thanks. Thanks very much, Jackie. All right, the next group coming in, excuse me, is going to be the the YWCA for both of their requests, Caring for Children, and then Elida Homes.
And Julie, if I can just add to remind the folks on the first round, if they could drop off for the next folks to come in.
Right. Do we have anyone from the YW on the line yet? I'm not being pushy, I'm just wanting to make sure.
Julie, we have been emailing this morning with Sela, and I believe she should be available. I can email her right now while you're waiting if you want to start with someone else.
Yeah, do that. I can go to somebody else. Let me just ask though, Paul, your reasoning around theoretically making it easier on the YW to only have one CDBG contract to manage versus two, and maybe they can move money around internally to help fund the other program. Have you talked to them about that? Are they amenable and open to that? Or do you know?
I believe, quickly, apparently, Sela's on the call, but her audio, she's struggling with her audio, FYI. And yes, I believe that information was shared through our team with the YWCA. Ultimately up to them.
Okay, so maybe if she could drop off and try to join back in, And in the meantime, we'll go ahead and jump to Caring for Children. Is that person on the line?
I'm here. Can you guys hear me?
Yes. And who is this?
All right. So yeah, I was having a problem with the mute button technology. I apologize.
That's all right.
Good morning. My name is Salamanaya Merritt. I'm the Chief Program Officer here at the YWCA. And just to respond to our two programs that we apply for, we are more than amenable to just having ECC, Empowerment Childcare, being funded. We are okay with that.
Oh, great.
To start that off. Okay.
Thank
so,
you.
Empowerment Childcare, the goal of that is to remove barriers and empower women and families to achieve economic security. We've been doing this for many, many years. We are the only organization that we know of that is doing this at this time in the community and has been doing this. We're currently working with the Family Justice Center. We're offering childcare 58 hours per week, Monday through Saturday. And we're open from 8 a.m. or 7:30 a.m. to 8 p.m. Monday through Thursday. And then from 7:30 a.m. to 3 p.m. on Fridays, and then 9 to noon on Saturdays. And again, like I said, we're the only ones who are offering this service in our county. We have our ECC director, who is a trained community service navigator. So we work with the county as well. We're doing community markets. We're making sure that our participants and their family have food, that they have the resources that they need. We're working with them on educational goals and as well as goals to find work and how to pay their bills. Our Getting Ahead program, which is another program that we have here that's working with women to help them work their way out of poverty, uses our childcare as well as our Mother Love program. So we have a plethora of services that we offer, and we really work with a lot of people in the community. During COVID-19, we did shut down our Empowerment Childcare, but we opened up our center as an emergency childcare to offer essential workers, which was essentially nurses, doctors, those individuals who are working in nursing homes, childcare during this time. And then we expanded that we realized that essential workers are also those individuals who are working in the grocery stores and who are working in fast food places, who have to keep people fed. And so we continue to do that work. We did reopen ECC in June, I think the 6th. And so slowly building our numbers back up with ECC. We do have requests for people to come in and to be able to utilize this service as people are going back to work, and schools are starting to open back up, and AB Tech will be offering online classes. And so we're continuing to do this work in spite of COVID-19, and we did keep that staff on during COVID-19 to help with essential services. Any questions?
No
Any
questions.
questions from the committee? Whoops.
No questions.
Okay.
Go ahead.
And then for Mother Love, I guess I don't have a presentation.
Okay.
Or would you like me to still present?
Why don't you give us 30 seconds on what it is?
So Mother Love works with pregnant and parenting teens in high schools within the city and the county. And what we do is we offer lunch bunches. And even during COVID-19, we were offering virtual lunch bunches where the ladies were able to get together and just kind of talk about the things that were going on and have taking place with them during COVID-19. We know that it is hard when there isn't a pandemic going on, and it's even harder when there is. And we were dropping off food baskets to them and making sure that they still got to their doctor's appointments. And so the work didn't stop. But yeah, it's a really, really great program.
Okay.
And how many participants do you have with Mother Love?
Mother Love, right now, so at any point in time, we will have at least 2 to 3, I call them cohorts. So I would say 32, between 32 and 48. I don't know the exact number right now, but I think it's close to about 40 that we're servicing right now.
Great. All right. Any other questions from the committee?
No questions.
All right. Super. Thank you so much.
Thank you so much. Have a great day.
Yeah, you too. So let's move on to Caring for Children. Paul, do we know if we have someone for Caring for Children joining us today?
Yes, I was on mute.
There you are. Okay.
I'm here. This is Amy Hobson. I'm the Executive Director at Caring for Children, and I'm here today to talk about Trinity Place Runaway and Homeless Youth Shelter. So prior to COVID-19, we put in a request, and we're definitely in need of that. Obviously, since COVID has hit, our numbers and the request for placements in our shelter have increased greatly. We have children ages 7 through 17. We have not shut down during COVID. We are still live in person. Not only are we getting children that we typically get that have run away from home, that are truly homeless, that there's stressors at home, mom and dad are having some challenges, kiddos are having challenges. So we get a lot of kids coming in for mental health reasons. Now with COVID in place going on, there are more stressors in the community. Everyone is feeling that. Teenagers especially, because they're not able to socialize as they did previously through school. So we're just seeing a huge increase in referrals. We are able to serve 6 children at a time. We provide all of their food, all of their meals. We do school, so it's online school. We have tutors that come in and work one-on-one with those children. We do case management for them as well as their families. We're able to refer out to other programs in the community. So we are, we're feeling a little overwhelmed. We have come up with a few different incarnations of what quarantine looks like at Trinity Place, because we are getting children in that potentially have COVID or have been exposed. So we have partnered with some community agencies to get all of the children tested before they enter Trinity Place, but we are having to quarantine them in separate rooms from one another. So just a lot of challenges around that. And we appreciate being considered for this funding. It is crucial to us because we certainly understand that with school being on the Plan B, which is for children kindergarten through 8th or 9th grade, they're going 1 week on site and 1 week virtual. And then 8th through 12th grade or 9th grade through 12th grade, all of the students are virtual. And so parents are not able to provide that virtual support and children are falling through the cracks. And so Trinity is the only emergency shelter is where they're ending up. So that's kind of where we are right now. We're asking for this funding actually specifically, we had requested for a case manager. It goes to a portion of the case manager's salary.
Okay.
So I'm happy to answer any questions.
How many beds do you have available? Well, how many beds do you have in all?
So we have a total of 8 beds. We have 4 bedrooms. We are licensed to have 6 children at a time, but that child might stay with us anywhere from 1 day up until 3 weeks.
And do you have any on-site teachers?
So all of our staff, none of our staff are licensed teachers. They all have a variety of degrees, bachelor's, master's degrees. We also partner with the McKinney-Vento through liaison through Buncombe County Schools and Nashville City Schools. But what we did over in the spring is all of the children had laptops and we had staff there to do one-on-one support, educational support.
So if you're unable to house a teen due to occupancy issues, who do you usually refer them to? Who are your partners there?
There is nowhere else for them to go. So we give priority to children that are truly homeless or that have run away. We get referrals. That's who we give priority to. We turn down foster care children, and those foster care children are sleeping on cots in the DSS building. That's what it looks like. So we prioritize children that are truly homeless.
Thank you.
Absolutely.
Any other questions? All right, great. Thank you so much. And we are moving on to Elida Holmes.
Hey, this is Sarah Dickerson from Elida Homes. Can everyone hear me all right?
We can, thank you.
Well, thank you all for having us here today. So Elida Homes applied to CDBG for our ESTA program. ESTA is Elida Students Training for Advancement. It is a program where we're working with 16 to 25-year-olds at transitioning age youth range. And our program helps those youth to, originally we were a workforce development program helping them to get their jobs together so that they can achieve independence. But now we have recently rebranded to do both homeless services and workforce development because we realized that the majority of our youth were facing homelessness. So, in the 18-19 fiscal year, we had 89% of our youth who were truly homeless. And in the 19-20 fiscal year, 75% of our youth were truly homeless. And so we realized that this is a huge need that we needed to address. So over my time in ESTA, I've really focused on learning more about what services there are and how we can help. And with us recently receiving home dollars to provide rapid rehousing, our goal was that we could use some CDBG so that we could be able to support some of our caseworkers. What we do is we provide a caseworker to each of the youth that comes to our program, and we teach them vocational skills, but also address their housing needs. We have 8 spots on our campus currently for homeless youth to come and live at for a transitional period while they work on permanent long-term housing. And we specifically are now hoping to be able to use our rapid rehousing money to be able to help them afford that long-term housing. And our case managers are all being trained to help work with landlords and help the landlords to understand that a lot of these youth are coming out of the foster care system, they're coming out of the mental health system, they're coming out of different places where even if they had a great childhood being raised in a single family home, they don't necessarily have rental history or credit like some other people applying for homes in the area might. So all of our staff are trained and able to help youth with getting to know those landlords and being able to advocate for themselves to be able to have a place to live. And so, we know that from the National Alliance to End Homelessness, that 25% of our youth coming out of the foster care system within a year are going to become homeless. And within 18 months, that's going to be 45% of them. So we've seen the abuse that come out of whether it's Alida's foster care system or Alida's mental health system. And within a year's time, they're in a place where they don't have anywhere to stay. They can't really support themselves. And so we really wanted to create an upstream approach where we're address the barriers to housing and employment that our students are facing. Our goal is that by doing this, we're going to be able to divert youth from entering into the homelessness system and becoming chronically homeless and really saving our community a lot of resources that then have to go into addressing that chronically homeless population. So, if anyone has any questions on how we do that and what we can do, I'm happy to answer.
Thank you. Any questions? And I have a question. Remind me how much funding Alida Homes got for this program from the Home Consortium. Paul said 6 or 7.
Yeah. We got $6,000 to start our rapid rehousing program.
Okay. All right. Yeah. Any questions from the committee?
No questions.
Okay. Great. All right. Thanks everyone in that group. If you would drop off, please. And the next group coming in is going to be Haywood Street and Helpmate. And Paul, while those groups while we're in this transition, I want to ask the staff to, I want to preview a question for you that I'm going to be asking, which is, can we use either our any of the COVID CDBG money that we have set aside or the ESG grant money, either what we've already received or what we anticipate receiving, to fund any of these homelessness related programs. And the ones, so Helpmate, Alida, Trinity, Pisgah Legal, and then we're going to hear from Haywood in just a minute, but I'm going to include the Haywood Respite in there as well. So what I'm trying to do is, because this public sector, this public service money is so limited, can we fund some of these groups out of another pot of money so we can then more fully fund the groups that are remaining in this sector. And if we I just added it up, so I'll just tell you, if all of those groups that I just mentioned, Helpmate, Elida, Trinity, Pisgah, and Haywood, their total requests are $145,000. So if we can figure out a way to fund them separately, that leaves us more money in this bucket to fund the groups that are remaining, that obviously the needs of who they serve are increasing tremendously. So that's the question that I'm going to be asking.
So Julie, hold on that answer for a bit as you get through this. That's great.
Yeah. Just giving you guys a chance to do that and answer it when we're all finished. Okay. Do we have Haywood Street on the line?
I'm here.
Great.
Okay. Great.
Tell us. Go ahead.
I'm Laura Kirby. I work as the executive director at Haywood Street. And I appreciate the opportunity to be here. I'm glad to hear Paul talk about y'all's desire to partner with us on developing housing on city-owned property. That is definitely our deep desire. And I'm happy to talk today about Haywood Street Respite, and I'm hopeful that there is a pathway to funding for both of those programs, as they are quite different places on the spectrum of the continuum of care for housing services. So, but at any rate, Haywood Street Respite is it's a medical respite program. We provide a safe place for homeless adults to stay on a short-term basis after being discharged from the hospital or experiencing some kind of acute health event that, such as outpatient surgery or some type of illness or injury. It is a place where people can finish getting well, basically. You can imagine if someone gets out of the hospital, typically if they're going home, they have a safe place to just finish getting well, get back on their feet. And if instead they're going out on the streets, there's a really good chance that they're going to end up back in the hospital. The overall purpose of respite is just to prevent this downward spiral that can happen and easily gain momentum when a homeless person gets sick or is injured. It can lead to a progression from episodic or transitional homelessness to chronic homelessness. The program is based on a national model. Haywood Street Respite is one of 65 programs of this kind around the country. And because of the close association between housing and health, data supports the conclusion that these programs contribute to improved health as well as improved housing outcomes for individuals who participate. We've been in operation for 6 years and have served about 1,000 people during that time. Only around 25% of those folks have been readmitted to the hospital within 3 months. That compares to about 50% of homeless folks who are readmitted in 3 months in other communities where medical respite programs don't exist. About 90% of the people we've served have attended their first follow-up appointment with primary or behavioral health care, and 3 out of 4 went somewhere other than the streets or camping when they left. Almost 50% secured a place in transitional housing setting or moved into permanent housing when they left respite. We can serve 8 people at a time, so around 200 people in a year is typically how many we serve. So the HUD outcome that we are most closely aligned with is moving from living outside or in an emergency shelter to transitional or permanent housing. And our expectation would be that over a year, we could help 100 people move from being unhoused to a transitional or permanent housing setting. So I'll stop there and see if you all have any questions. Yeah.
Great, thank you.
I have a question. Yeah, I'm pretty familiar with your service, and I wanted to know more information about how you all support by providing transportation. How do you support the individuals in making that first follow-up appointment to continue with their recovery and wellness?
Sure, yeah. So we have, we call our volunteers companions. So we have a lot of companions who support what happens at Haywood Street Respite in addition to the paid staff. And so there's several dedicated companions who help. They spend pretty much all day being available to help our friends get back and forth to doctor's appointments. When we have new referrals from the hospital, our companions will go over there and pick our friends up and bring them over to respite. Early on, we tried relying on taxi service and other options, but really found that using volunteers was the best approach for us, and we've been able to fill it with that resource.
Yeah, I have a friend who has used your services before, and I was wondering, how do you support a person in getting the proper medication after, while they're recovering? Because I know they have to do that kind of in person. Do you all have a strategy?
We work closely with the hospital so that on discharge, as often as possible, someone is sent with 2 weeks supply of medications. And then if they have other prescriptions that need to be filled, again, we have companions who can go to the pharmacy, most often at Winches, and they are able to, with documentation from the individual, they can pick up the prescription there and bring it back to respite. So that's pretty much how that works.
And what is your request? What's the amount of your request?
We were asking, it was either 20 or 25,000. I'm sorry, I don't have it right in front of me and I can't recall.
Do we know that, Paul? I'm sure
it's 20,000. 20,000. Are y'all there?
I'm here.
Yeah, so it was 20,000.
Okay, thank you.
I don't have any more questions.
Okay, and I've actually got a question. Tell me about, do you have medical volunteers, medical personnel, nurses, or physicians who come in to help your community members?
Yeah, so our program manager is a nurse, and so anytime someone comes into respite, a nurse is always involved in reconciling the medications, and but the rest of our staff are not healthcare professionals because the setting is one just like as if you were at home. But the nurse is involved in the daily assessment of friends, and then we work closely with Dale Fell and Winches and community-based healthcare providers who often will come into respite and meet with friends there. We're frequently taking friends back and forth to see their providers, but a lot of them do come into respite on a regular basis and meet with friends there. And so it's a lot of collaboration. We have an advisory board that meets every quarter that includes healthcare professionals from Mission and again, these community-based providers, as well as behavioral health providers and supportive housing providers. And there's tons of support from all of these folks for what we're doing, which we really appreciate.
Great. Super. Thanks. All right. If there are no other questions, we will go on to, I think Helpmate is next. Thanks very much, Laura.
Good afternoon. Can you all hear me?
We can. Hello, April.
Hey there. It's good to see you all. I'm April Burgess Johnson. I'm the Executive Director for Helpmate. I'm sure most of you are already familiar with our organization, but we've been around for 41 years. We provide safety, shelter, and support to survivors of domestic violence. We serve about 3,500 victims here in Buncombe County every year. Between 200 and 225 of those victims come through our emergency shelter program. We prioritize shelter placement a little bit differently than other types of shelters may. We use an evidence-based tool to help predict homicide risk. And so we are literally sheltering those survivors that are most likely to die if we don't provide that shelter. And so it really is kind of the tip of the spear for the life-saving services that Helpmate offers. The COVID-19 crisis has been hard on everybody, but it's been extraordinarily difficult for domestic violence survivors. The stay-at-home orders and now recommendations that are in place do a great job of protecting most of us. But when your home is not a safe place to be, It means that victims and often their children are trapped inside that toxic and abusive environment without means for escape. Helpmate's emergency shelter typically has 20 beds for folks who are fleeing domestic violence. And we're regularly having to refer to other shelters, survivors that we don't have space for. But the way our shelter is laid out, there's 5 bedrooms that have up to 3 beds each, and each set of 2 bedrooms shares a bathroom. And so as you can imagine, that congregate living setup was not safe or healthy for folks during the COVID crisis. And so we moved temporarily out of our shelter building and took kind of a leap of faith, and we've contracted with a local hotel that is separate from the hotel that is sheltering the other unhoused people in our community. And just this quarter, April to June, we sheltered twice as many people as we typically shelter in a given quarter. The need is just overwhelming. We've seen in other countries who are a little bit kind of ahead of us in timeline on this pandemic, that domestic violence homicide rates have gone up, and that as those stay-at-home orders are lifted, people are coming more and more to seek services, and Helpmate is certainly seeing that with both shelter requests and hotline call volume. So this funding is more important to us now than it ever has been. We requested $30,000. Staff recommendation was $20,000. And this funding supports key staff who make those shelter programs happen. And we're doing some unusual things right now. We're providing counseling services to folks who are in our shelter who want that service via video conference. So that means that we're having to provide more technology for folks to be able to do that. We're bringing in 3 meals a day because folks don't have access to a kitchen facility. And so we're stretching and doing some unusual things to meet the needs of our community and those folks who are so extraordinarily vulnerable because they're homeless, they're experiencing violence, and most don't have the financial means to make another arrangement right now. And this type of violence, it disproportionately impacts folks in our community who are already addressing other or living with other forms of oppression. So we're going to see higher concentrations of folks who live with poverty, higher concentrations of LGBTQ folks, higher concentration of people of color, because those oppressions that exist in our society become tools that batterers use to deepen that control over victims. And we see that exacerbated even more right now during the COVID pandemic. And so we will be extraordinarily grateful for anything that you all can do to lend support to our efforts. And I'm happy to take your questions.
Thank you, April. Any questions from the committee?
I can imagine that our waiting list is probably really large right now. I was wondering if there was an individual family from another state and they're really in some desperate situations, if they would be considered for housing just because of the high vulnerability.
Thank you for that question, Councilwoman. And we have done that occasionally, folks that are fleeing to Asheville from another area who don't have another safe place to be. The sad reality is that much more often, because our shelter capacity is limited and our community is large compared to the rest of Western North Carolina, that we see more outflow of victims from our community than we do inflow of them from other areas. And it's capacity limitations that fuels that outflow fairly significantly.
Okay. Any other questions? Great. Thank you very much, April.
Thank you. I appreciate you all.
All right. So that kind of wraps it up for the challenging part of our the public service groups. We're now moving into the non-public service groups, and so April and whoever else was in that section, if you guys can drop off, then we can get the other folks loaded. So the next group is, again, Homeward Bound, Habitat, and MHO. And y'all, we are just honestly running short on time. So everybody who has been recommended for funding here has been recommended for full funding. And as you know, we have a contingency. So I'm just going to ask you to be super brief because you're not really fighting for money here. So let's jump to, and if you want to jump on and say, I don't have anything to present, that's fine too. But I'm cognizant of the time. All right, so Homeward Bound is up next.
Hi, Julie. Thank you. It's Meredith Spicer, Executive Director at Homeward Bound. Ours is a pretty straightforward ask. It's for $81,000 to support our permanent supportive housing program. It would really be for staff support for a housing case manager at 100% and a housing specialist at 50%. And it would be to request services for 16 new households. Primarily those going into HACA properties, Housing Authority properties, and through scattered site, and would provide the case management support or allow for that support in finding the most appropriate housing option for these clients.
Okay. Great. Thank you. Any questions? And I guess this is really where the point that I made earlier on your first presentation, this would be where if we put any more of that contingency money towards supportive services, you would be happy to have that.
Yes. Thank you.
All right. Any questions from the committee? All right. Thank you, Meredith. Moving on to Habitat. Do we have someone from Habitat?
Good morning. This is Andy Barnett with Habitat for Humanity in Nashville.
Great.
Thank you, council members, for making the time to hear a little bit about this. We're asking for funding for our home repair program. We're asking for $128,000 to help complete repairs on 16 homes in the city of Asheville. We look at protecting and preserving our existing supply of housing through repairs as a critical part of the overall housing solution in Asheville. We know that it's important to house our growing population. It's also important to make sure that existing homeowners can remain in the homes and communities that they love as long as they choose to. So this is an important investment in what is a $500,000 total program for us. This work is a piece of the total program that will serve about 55 households over the course of next year. Your funds get leveraged by about $3 for every $1 to make that all work. And in most cases, we are doing repair projects that address multiple housing deficits, accessibility, major systems, plumbing, electrical, heating, structural problems. And these are by and large investing in homes of older members of our community, older neighborhoods in our community, and a large number, about a third of these projects in helping invest in homeownership in African-American households and historically Black neighborhoods in our community. So I appreciate the recommendation that we received from City Council and look forward to the decision that you all make, and happy to take any questions from you.
Okay. Any questions for Andy?
Yes, I have one question.
Mm-hmm.
Andy, do you anticipate or forecast any, because of the COVID-19 and people losing jobs and all that stuff, uptick at all in doing this work for people who would normally be able to kind of pay for this work on their own that might fall into this category? I'm kind of just putting it out there, but I'm curious.
Yeah, I haven't seen anything specific to that, Councilman, but we have seen an overall uptick in this program. We have scaled down the number of projects that we're going to do in in the past year due to COVID. In the next few months, we're scaling down the rate that we can get through projects, just because it takes we can use fewer people in the home. It takes more time to clean on the front end and the back end and all of that sort of thing. But demand has been incredibly strong for this program. We actually pretty much have our whole next year already in the works, scope of work documents done, just because we have that much volume of activity. Honestly, a lot of the folks that we see in this program are beyond working age, so the effects of unemployment don't really hit this program quite as hard, but a lot of need for keeping people in their homes and safe and healthy right now.
Appreciate that. Thank you for the insight.
Any other questions? All right, great. Thank you, Andy, so much. And do we have anyone from Mountain Housing?
Hi, this is Lee from Mountain Housing. Can you all hear me?
We can, Lee. Welcome.
Great. Well, thank you. Thank you for this opportunity to talk to you for a minute about the Mountain Housing Emergency Home Repair Program. I have been at Mountain Housing now for 18 years. We have been doing this. This is the cornerstone program for Mountain Housing. And since 1988, we've done over 3,600 repairs for folks. They are all imminent threats to life or safety. They are all folks that are under 50% of median income, and all special needs. This program keeps people in their houses. I don't paint, I don't clean gutters. I'll fix your leaky roof, or if you don't have heat, we will rectify that. Structural issues, a lot of accessibility issues, bathroom modifications as people age. We've worked closely with the UDI, Universal Design Institute, on aging in place, removing tubs and putting in showers and ADA toilets and floor repairs and things like that. It's something that is critical to these folks when they're making $20,000 or $25,000 or $13,000 on Social Security a year. Taking care of issues like this, a furnace is $5,000-$6,000. For them to come up with that kind of money is just not happening. So it's impactful, and it makes a huge difference in the community. And with that, I'll just throw it out there. I'll keep it brief, and if anybody has any questions, I'm happy to answer.
I don't have any questions. I just have comments. I love these types of programs because I know people who benefited from them specifically. And so exactly what he said, furnaces, and I've seen homes that benefited from this program that had major structural issues, needed a roof, a bathroom redone, and there was just no way possible that these folks could do that. And so I admire these types of programs because they really do, in my mind, give a leg up for folks who would otherwise probably be living in a condemned home or future condemned home, and be able to keep their house. So I appreciate the work that folks are doing, and no questions, just a general comment to say thank you.
Well, thank you, sir. I appreciate you saying.
Yeah, and I will echo that. I mean, this has to be a key part of our housing strategy, which is to keep people in their homes and keep the value of their homes. Keith, to your point about building generational wealth, keeping the homes in good repair so that when and if the time comes to sell them, they're as valuable as they can be. So, all right. Anything else for MHO? All right. Well, then we will move on to our next group. And if I can ask Lee and Andy to drop off the line. And
certainly. Thank you so much.
Yeah, thank you. So the last group is going to be the Community Land Trust, and then Mountain BizWorks, Carolina Small Business, and Eagle Market Street. Oops. And when we have someone from the Land Trust on the line, just jump right in.
Good morning. This is Anna Zieska. Can you all hear me?
We can, Anna. Welcome. And welcome to your position.
Thank you. Thank you. It's been quite strange since I really haven't been on the ground in Asheville a whole lot since I started this position, and would have really loved to meet all of you individually in person, but haven't had that chance. So glad to be able to join you all and see you all. And I know we're running out of time quickly, and so I'll keep it brief. I know we're not being recommended for the CDBG allocation here, as it was tied to our home request, which we did not receive. But we appreciate the time, and I just want to give you all a quick update. I think you all probably know that we're looking, as Paul mentioned earlier, to work on documents for the 1.1 million. And we're hoping that get the resolution for disbursement of the 1 million on the July 28th City Council agenda. We know that you all are also working to get the 100,000 on that City Council agenda as well, but there may be some time constraints. And so I just really want to advocate for, if we're not able to get both of those on the City Council agenda on the 28th, that we really just push for the 1 million. I know there's been staffing concerns around being able to have capacity to administer the 1 million, but we are staffed with me being part-time. I do have capacity currently to administer that for the first portion of that 1 million. And for those who may not know, we are currently under contract on a home, which we would need the disbursement of those funds in order for that contract to go through, so we can close at the end of August. So with that, I'll just be here for any questions you may have.
Great. Any questions from Keith or Shanika?
No questions from me.
Okay. Great.
Thank you.
Thank you so much, Anna. We appreciate it. All right, Mountain BizWorks. Anybody from Mountain BizWorks on? And Anna, I might need to ask, you might need to drop off and rejoin. Not sure how that works. Paul, do we know if we have anybody from Mountain BizWorks joining us today?
We emailed with Matt Raker earlier, so I'm hoping he's around. I'll email him again.
Okay. Maybe while we're waiting for him, is there someone from Carolina Small Business?
Yes, good morning, everyone.
There you are.
I am here. Hello, good morning.
Hi.
My name is Tara Brown, and I'm interim director at Western Women's Business Center, a program of Carolina Small Business Development Fund. And we work in partnership with Mountain BizWorks and Eagle Market Street under Opportunity Asheville. So we're a collaborative and have been for 3 years under this grant funded by Community Development Block Grant funding. Us specifically at Western Women's Business Center, we offer one-on-one coaching, training, and access to capital across Western North Carolina. Specifically through CDBG, we offer those services for low and moderate income entrepreneurs here in Asheville. That work has supported ongoing and more in-depth training for low-income entrepreneurs here in Asheville than we would be able to offer without this funding. So we've been very fortunate to get it for the last few years. It also supports business development specifically for people of color. So we offer our monthly African American Business Association through this Community Development Block Grant, which is happening right now, normally in person at the Eddington Center, but like everything, it's online right now. So we're very happy to have this support. And I just wanted to add that in the last year, we were able to actually exceed our goals. So we're very proud of that. We provided training to over 300 clients. We had 14 clients start or expand their business under this funding, specifically for low and moderate income businesses in Asheville. And we had 15 clients create or retain jobs through this funding. So we're very proud of those outcomes and look forward to continuing this work. I'll also just add that among our clients who received one-on-one coaching, 39% were people of color. So we're very happy to continue this work and look forward to the future. Happy to take any questions.
Thank you very much. Any questions from the committee?
No questions.
All right, great. Thank you so much, Tara. And I'll ask again about Mountain BizWorks or Matt. Do we have Matt on the line or available?
I think he is, Julie. I'm making sure he's in the room.
Okay, well, let's jump to Eagle Market Street, and then if there's someone from Eagle Market Street, and then we can jump back to Matt. And while we're waiting for Eagle Market Street, Paul, just want to, again, not recommending, so just to remind folks, these last three are all in partnership together. Okay, I see Stephanie's here. The recommendation to not fund Eagle Market Street is that they've got money, they've got previously allocated money that they haven't drawn down yet. Is that a pretty significant amount? Is that right?
Correct. About it's like math there too now. About $30,000 from 17-18 and $81,000 from 19-20. But we're working on it.
Okay.
Stephanie's been great.
Okay, great. Why don't we let's jump back up to Matt, and then we'll go to Stephanie. Matt, can you talk to us?
Hey, Julie. Hey, everybody.
All right, you're in.
Great.
Yep.
Let's see, everyone. The last 4 months have been quite the challenge for our.
Matt, hang on just 1 second. Matt, you're really coming in and out. I think maybe, I don't know if you can go to a different place in your house, or actually maybe even drop off and come back on, and we can go to Stephanie.
Okay, let's do that. I'll
Oh, actually, that's good. Wherever you are right now, that's good.
Okay. Well, so we're, I think over the last few months, we've seen just the importance of the Opportunity Asheville initiative and partnership. It's, really positioned us to be able to respond, quite quickly, and, looking, it's going to be challenging because we've got sort of our normal work plan, which we've been laying the foundation for, and are looking very forward to having this layer of resiliency work on top of that. It's kind of having to do both, where we're getting a ton of corporate companies that are in business now that really need targeted assistance, as well as we're actually higher than normal level of demand from entrepreneurs wanting to get into business. So I manage sort of the caseload on both those fronts. I think partnership in place is really crucial. It really allows us to meet folks where they need to be, whether it's the IDA program starting there, which especially in the current economy is going to be even more important as part of a stepping stone towards the mobility of entrepreneurship, and then partnering with Carolina Small Business Fund on our classes from the Latino program to the African American Business Alliance, and then our foundations course and all the other things that we're doing. So we're really pleased with the plan coming forward the next year, which will be a combination of resilience and emergent, and we'll be glad to take any questions that y'all have on our proposal.
Great, thank you. Any questions from the committee?
No questions.
Okay. Great. All right. We will go to Stephanie. Thank you, Matt. And just thank you also for all the extra work that Mountain BizWorks has done this year on the One Buncombe Fund and the TDA Fund. And you guys got a lot thrown at you, and you handled it really well. So thank you.
You're very welcome.
All right, Stephanie, join us, please.
Thank you. Good morning, Councilman Mayfield, Smith, and Young. It's a pleasure to be before you again this year and to be here in support of Opportunity Asheville. I want to take just a moment to give you accolades for your recent courage and willingness to commit to reparations for the Black African American citizens of Asheville. it's our continued hope that these actions will follow that brave decision, actions that can respond in real time to the needs of community. Very quickly, I'd like to offer that it will most likely present us a challenge as we try to do such a monumental repair, and that we would not be able to do it without dedicated partners such as Opportunity Asheville, who are very invested in moving our communities from generational poverty to generational wealth. This will require education, safe, affordable housing, and monetary resources for small business. I'd like to close by saying that we're here with a little bit of a heavy heart today. And you may ask why. Well, we're a little bit saddened that we find ourselves in a position where we, as a mature Community Development Corporation, CDC, are not able to be funded in this round of applications. Eagle Market Streets is working tirelessly with partners like Dogwood Health Trust, Mission, HAC, Senator Terry Van Dyne, and Buncombe County to ensure that the most fragile of our businesses are receiving support. Now, let me hasten to say that we fully understand and appreciate the weight and consideration that led to this decision. It's not that we don't understand. However, we feel like it still represents a glaring inequity. As an integral member or partner of the Opportunity Asheville, our CDC provides first in dollars of capital more often than not for Black African-American businesses who don't have the luxury of a good uncle or aunt or other means to secure these dollars. African-American businesses continue to represent 2% of all business ownership in the city. We warrant that this is unacceptable, and that as we as the entry point for most of these fragile micro enterprises need capacity to continue to seed these businesses. We understand that anti-racism cannot be addressed by applying an intellectual lens to it. It has to be by dismantling business as usual, gatekeeping, and other barriers that prevent African Americans from participating as true asset builders and wealth creators. With this, our ask would be that even if we can't make a revisit in this moment, that we would be allowed to work with staff for ongoing opportunities to seed our commercial properties for low to moderate income individuals to lease. Thank you.
Thank you, Stephanie. So again, just to get this number in our heads, there's about Paul, is it about $110,000 that's sort of sitting in the bank for Eagle Market Street from previous years? Is that right?
Approximately, yes, Julie, and we are anticipating a new draw request shortly, I think, from Stephanie in the amount of $10,000 to come in shortly.
And Stephanie, would you anticipate that $110,000 would be sufficient for the next year so that you could come back to us, next year with essentially a drained fund, having pushed all that out into the community, and now you need more, or I will just say my interest is always in pushing money out to be used as quickly as possible.
Yes, ma'am. As a matter of fact, we currently have about 26 participants that are in the pipeline to access these dollars that are currently on the table. We also have a proposal that staff worked on with us, and thank you again, Paul and Megan, for being such brain trusters with us in looking at the immediate need COVID dollars that we will be pushing out here in before the end of July. So our hope is that, again, there would be, if not in this moment, in a subsequent moment when we run out of funds, an opportunity to come back to council or back to CDBG for support around IDA and our incubation leases.
So I don't know that there would be that opportunity later. I mean, if we hold out all of this contingency right now, there could be. My goal is going to be to try to put that contingency to work right now. So I guess, Stephanie, my question to you would be, if you, you've got the businesses in line that and you think that might eat up the money that you have in the bank, so to speak. So
that's correct.
If there were, is there a lesser amount here that you think would be? I mean, I realize 120 is ideally what you would love. I guess my question is, what do you think is realistic for you to meet your need and the needs of your clients for the rest of the year?
Right. So certainly, we submitted the amount that we thought would be adequate to move the program forward in subsequent years. But we would be very open to taking a lesser amount if it meant that we would at least have something coming for that for this round.
Okay, great. Any other questions from the committee of Stephanie? Okay.
Thank you.
Thank you, Stephanie. All right, so before we dive into this, and let me just ask that all of the groups that were on and presenting, if you can sort of drop off at this point, and I don't know how that works. So I think we need to do a couple things. Number one, I think our last agenda item of getting an update on the property probably just needs to wait until our next meeting. And Nikki, I'm very sorry about that, but this conversation might take a little bit of time. And this is really important, and I want us to make sure that we're getting it right. And I have a hard stop in probably about 25 minutes. So, okay. So let me start with this. So I asked a question in the middle of the presentation of staff of whether we could use any of the COVID CDBG money or the ESG grants for Helpmate, Elida, Trinity, Pisgah, and Haywood. Do we have an answer on that?
So I can jump in with the COVID CDBG funding that you all approved at council, I guess last Tuesday. So that funding right now is going to be going to rental assistance, about $399,000, with both homeless prevention and rapid rehousing with Homeward Bound, and eviction prevention with Pisgah Legal. We're also looking at reimbursing some of the security charges at Hera, as well as some of the operational costs at the Red Roof Inn not covered by FEMA. And then we're also putting some funding into kind of alerting us with how this COVID money can be spent. But that's where that CDBG COVID funding is being spent right now. That proposal is going into HUD, approved by you all, and that will go into HUD no later than this Friday, most likely.
Okay. And none of that is duplicative of anything that's in front of us, correct? Am I muted?
That's correct. And then I think Brian might have an answer regarding ESG.
So the ESG dollars, the COVID dollars have to be specifically related to response around the coronavirus. So for some of these ongoing activities, that's business as usual, that we're not going to be able to use the ESG CV dollars for some of those ongoing routine activities.
So what I have heard is that every one of these organizations that is dealing with homeless response, homelessness response is having increased costs related to COVID, because they're having to space people more, they're having to serve fewer people, all of that. That is not teased out in these applications.
Julie, if I can jump in quickly just about an additional funding source. As you remember, Brian talked about that other potential $800,000 that's coming in from ESG. So regarding the COVID CDBG dollars, there were 3 buckets of money that could potentially flow into Asheville. It was $5 billion federal, and there were 3 buckets there, $2 billion, $1 billion, and $2 billion. The first $2 billion in buckets is where we got the $615,000. The second $1 billion bucket, as that came in through the state, that went to non-entitlement areas of the state. So counties that don't get CDBG funding, like Buncombe County, I believe, would be eligible for that. It might have been something that Robin was alluding to earlier. The third bucket of $2 billion, we are anticipating that money should flow through to Asheville that could potentially be, as we're looking at this, if this makes sense, Julie, we're looking at additional funding sources coming our way that could alleviate the issues that we're having on the street right now and with our partnership organization. So again, the third bucket of $2 billion is supposed to come through the state. We don't know exactly how that's going to work yet. We are anticipating additional CDBG dollars at some point, I think by the end of the summer.
And again, would that be restricted to only COVID response related?
Correct. It would be to prepare for, prevent COVID related, but the nice thing about that money is that money comes in and we look to how to, if it works out, we'll be partnering with agencies who are on the ground doing that CV work. It's interesting, like these applications that came in February, as Brian said, for like business as usual. So we're trying to balance this with the business as usual with future COVID money that's going to come down the pipeline.
Okay.
So long story short, we're watching these dollars as they come in.
Yeah. Let me ask this. Do we have a deadline in making these awards? Or could we wait to see how much of that money could be used to address some of these requests?
It's kind of two different things, but the longer we go without approving our action plan for this money, the further that pushes back our con plan submittal for our 5-year consolidated plan, and then the longer then the window for HUD to get back to us with their HUD funding. So normally we get our contract with HUD sometime in October, November. Right now, because of the COVID delays, I don't think we're going to be even submitting the con plan till September, where we normally would submit an action plan or con plan in June, if not May. So the longer it would take to get that HUD contract and then reimburse our agencies for the money that they're spending. So we're kind of running in 2 lanes here with the normal funding and then watching COVID funding. Again, hopefully it makes sense as we're watching all of this.
So I suppose an option would be for us to make these or some version of these awards today. And then if there is additional funding that comes in for groups that were not fully funded and nobody in the public service category is fully funded, we could look at maybe trying to make up some of that funding with the COVID money if it's eligible for that.
That would probably be our best recommendation to keep everything moving forward. That would be our recommendation. And certainly if we got this third bucket of CDBG funding, one of the starts we could do based on your recommendations, Keith and Shanika, is immediately go to who wasn't fully funded out of this CDBG round and could the money pair together well with all the additional work everyone's doing around COVID.
Yeah, I like this conversation because I was really thinking a lot of our requests came in before COVID-19 hit. And I can kind of sense some desperation because even though these may seem like normal deliverables, they have been exacerbated by the coronavirus. So especially when we come into homelessness and youth homelessness, more of those direct deliverables as opposed to just supporting salaries or something like that. I would definitely like to look into how we can maybe have a conversation about what's really needed, because these are the services that have been represented today they really present that there is a threat to a person's life and their safety, especially the very beginning of the representation from public services. So yeah, I like this level of conversation.
Yeah, and I do think we're in this moment where there are certain groups that really are responding to a very direct need that, if not met, really is going to create a crisis in our community. I mean, we have a crisis, but is going to make it worse. And for me, those groups are the ones that are focusing on homeless prevention, On Track, which is really helping people figure out how to manage their financial situation with less dollars. And then also the childcare, the YWCA childcare, I think is going to be critical as we're trying to get people back to work. And so like if I had all the money in the world, that's where I would be pushing money. But we don't have all the money in the world right now.
I'm sorry to interrupt. This is Emily. Could I jump in with just a couple things about ESG? I just wanted to clarify some ESG eligibility. ESG is really prescriptive about what can be funded. And so of the current CDBG applications, only the emergency shelter applications would be eligible for CDBG funding. Trinity Place and Helpmate both currently would be eligible for ESG funding. Trinity Place and Helpmate do receive ESG funding now. And then Alida's program and Haywood Street's program would both be eligible activities under ESG funding. I also wanted to mention that the decision-making process around ESG is that the funding committee finance committee of HIAC makes recommendations based on the applications that are received, but ultimately those decisions are made at the state level by DHHS.
So we don't have a role in that. We council don't have a role in that.
That's right. And also a majority of ESG funding, Brian may have mentioned this in his presentation, we have 2 pots of ESG COVID money in the works, and then we'll have the regular 2021 allocation. That process will happen in the next couple of months. ESG runs on a calendar year. And for all of that, 60% of the funds have to be spent on housing stability activities, which are either rapid rehousing, which is the priority at the state level, or homelessness prevention. Homelessness prevention is a bit different than PSGA's homelessness prevention activity. So they have not applied for that. The work they do is not a great fit for the ESG parameters around that.
Okay. But Helpmate, Alida, Trinity, and Haywood Street are potential recipients of even potentially the ESG COVID funding. So that's what I heard you say.
Yeah, the emergency shelter activity is an eligible activity under ESG. There is, as Brian mentioned, those 2 pots of COVID money are really specific to COVID response. And so in that they'd be looking at, are you expanding beds because of COVID or that type? Are you targeting a particular population that's more vulnerable to COVID complications, that kind of thing? I would say as these guys have said, the applications for CDBG came in that kind of regular operation, business as usual way. I'd say that is probably a better fit for the regular allocation of ESG funding, but that's not a large pot of money. It's around $130,000 a year. And again, only 40% of that can be used for emergency shelter.
Emily, thanks for adding that and reminding about the next cycle of regular ESG funding. So jumbling a lot of buckets, Council.
So are we asking those questions when, since COVID has occurred? Are we asking our applicants, have they received any COVID response funding? Or have they applied, or do they look to receive before we start, talking about spending down our contingency?
Councilwoman Smith, we have not. I know that everyone's kind of in the business as usual, as they say, as we're saying, and the COVID funding. We assume everyone is on the lookout for any additional funding that they can gather, but I'm not, we're kind of perhaps the agency that folks are looking at of what are you hearing about money on the streets coming from the state or federal. So we're trying to keep everybody in the loop there, especially about this upcoming, hopefully we're doing okay with letting people know, but this upcoming dollars that we've been watching, including the state dollars of the House Bill 1200, I think it is, where they're hoping to put $200 million into rental assistance and mortgage assistance, another aspect of a potential fallout from COVID. Rental assistance, as we've talked about, but also people falling behind on their mortgages.
So, Paul, another question that I had asked of you during the meeting, actually by text, was whether the coordinated entry program could be funded through any other pot of money that's available to the city.
And Brian, I think you want to respond to that.
I'm sorry, I didn't hear the question.
Is whether the $47,000 request from Homeward Bound for coordinated entry, whether there is any other bucket of funding, including, frankly, general funds, which, I mean, Deborah's on this call, that she's probably not happy with me for saying that. But I mean, if this is a thing that we have to do, like we maybe ought to be paying for it somewhere else and making these funds available to other groups. But anyway.
Well, certainly a general fund allocation for coordinated entry would be the best possible scenario. Then it's consistent, and we know that's going to remain a line item in the budget and not subject to the demands of the CDBG public services each year. So that's certainly a great option if it can be done.
Kathy? Help.
Yeah, I'm just not sure that without talking to some of our budget folks that we can make that commitment at this point. Like I'm just not comfortable with where we are that we're able to make that commitment.
Yeah. All right, let me see if I've got any other notes here. Any other ideas? Any other rabbits to pull out of a hat? And again, our contingency, this 180 something thousand, that's 184,000. We can't, just to be clear, we cannot use any of that for public service, correct?
That's correct.
It's so annoying. Where do we fix this problem? This is a federal limitation, is that right?
I think that they will be looking at it with, what's happening right now, possibly. But for right now, we still have to fall within the parameters of what HUD shows us, and also working with our HUD rep in Greensboro about the best way to work with the normal cycle funding and the COVID funding that we're getting.
All right, so we have, let's just get back to procedurally where we are. So we have, this is what's in front of us here. Paul or whoever's driving, Jenna or Megan or whoever's driving, can you put up the funding recommendation spreadsheet? Can you share that on the screen so we can all be looking at the same thing? Thank you.
And Christina, I think, will be displaying that. And if not, I'm going to present.
So as that comes up, so what we have in front of us are staff's recommendations. And just to sort of cut to the chase here, in the public service areas, the two groups, the groups that did not get funded at all were Elida Homes at a $15,000 request, Haywood Street Respite Program at a $20,000 request, and then Riverfront Development Group, which withdrew its request. So we're really just talking about the two that I just mentioned, Elida and Haywood Street. I would love to give those groups at least a little bit of funding. I do hope that both of those groups, when we get the additional ESG funding, since you are eligible for that, if you could throw as many expenses as you possibly can into your COVID-related expense bucket and try to get that money, that would be great. Can whoever that is make that just a little bit bigger? My 53-year-old eyes not see that. And maybe even a little bit bigger. I don't know that we need to see those other, very many of those other columns. Maybe, yeah, scroll it. Does that get everybody? That gets everybody. Okay, that's good. I would love to give those groups some funding. I am really hesitant to take funding away from any of the other groups that none of which are already getting, none of which are getting what they have requested. That's just a statement. I don't really have a suggestion on what to do about that. Does anybody else on the committee have thoughts about that?
I would echo your statement, Julie.
And Julie, I don't know if this helps at all, but going back to what was talked about a few minutes ago, as additional COVID funding comes in, whether it's the ESG eligible or the COVID the CDBG COVID dollars, we can, specifically make sure that we're talking to these agencies that either end up not receiving any funding in this round and or weren't fully funding. So our team can make that commitment to try to get more dollars coming our way to these organizations.
That would be good and helpful. All right, let's, can we scroll down to the non-public service groups? Keep going a little bit so we can get all of the non-public service. Yeah, there we go. Okay. So here I would like to make a recommendation that we give Eagle Market Street, that we put a little chunk of money in there so that they don't, just as a little bit of insurance so they don't run out of money this year. I hear Stephanie, we're not intending to slight Eagle Market Street at all. So I don't know, maybe that's a $25,000 or $30,000 allocation. How does the committee feel about that?
Is that not or an official motion to make some changes?
I guess I am proposing that we make some official changes. So I won't make it as a standalone motion, but I would like to put, I'm going to say $30,000 in that bucket.
I will nod to that.
Okay, and then what I would like to do with the rest of that contingency is, can we have a conversation about, and I hear Brian that we might not want to do this unless we can guarantee funding next year, but at this point we're in a crisis and I want to respond to a crisis and we can figure out next year. Easy for me to say since I'm not going to be here. Sorry about that. But if what we need right now to help clear this pipeline around housing and homelessness is support staff, then I would like to put this money to work in that. And if that just means that Homeward Bound or whoever we contract with signs a year contract with someone, then maybe that's what that means. But I would be supportive of putting whatever the remainder, and I guess that would be about $154,000 toward trying to meet that need that Brian identified of support, housing support staff. However, city staff and Homeward Bound or whoever would be the recipient of that decides that it's best spent. That's the second part of my motion for this bucket of money.
But the recommendation from staff has been to kind of put a delay on spending that money so we can kind of see maybe there's a second round of rental assisted needs.
That is true, but we also just learned that we are expecting yet another round of COVID CDBG money that could be used for rental assistance as well. Is that correct, Paul?
Yep, that we are waiting for that third bucket to drop through the state to us. Yes.
And that was in the amount of $2 billion?
That's $2 billion federal that'll come through each of the 50 states. And then that comes through North Carolina, a new specially developed formula that will then filter down to Asheville. We anticipate, it's not guaranteed, but we are anticipating we would get something from that bucket, yes.
So do you have an idea of what that something may look like?
I don't know. I know that of the 1 billion bucket, Councilwoman Smith, state of North Carolina got 28, I believe it was 28 million, and that went to the non-entitlement. So if you use the math there, maybe we would get like 56 million into the state, and then they would divide that up between the municipalities on, again, a special formula that hasn't been figured out yet. But we're watching to be able to follow that to get an estimate.
But chances are, I mean, if we got 600 some odd thousand out of $1 billion, we would get, if they use the same formula or similar, we could get double that. We could get at least that.
It was the 615 actually came out of that first 2 billion bucket, so we could possibly anticipate something similar. But I do think that they'll try to go across the whole state, with this funding. So maybe, again, I don't want to estimate or guess.
Yeah, I mean, I hear you, Shanika. I guess maybe the other thing we could do here, well, I will just say my priority would be the staffing. We've set aside about $400,000 for rental assistance. We don't really know how much that's going to be used, how many people are going to take advantage of that, how far that's going to stretch. If getting staff on board now or soon would help clear the pipeline of people waiting to get into housing, that is where my focus is. That's where my focus is. But I do want to make the best use of the money. So another option would be, Paul, for us to just leave that there and let you, working with your team, with Homeward Bound, with Pisgah Legal, with some of our key partners in this housing and homelessness arena, for you all to come back and make a recommendation for us. If you think that is a better course of action, to come back in a month or two, I'm certainly open to that as well. I don't want to pigeonhole it if it's not the right thing.
So yes, I think that if the focus wants to be particularly on our homeless housing and that avenue, I think that we could bring you a recommendation. If that contingency, which is now at 154, stands, we could bring you a plan for that funding next month, and of course work with Kathy and Sam and Brian and Emily on how to best work those dollars.
Yeah, I like that idea. Do you have an idea of when the $2 billion or when we'll get our portion of the $2 billion? Is there any idea
I don't, Councilwoman Smith, and I apologize. We're still waiting on a couple other guidelines from HUD, regarding just, other CDBG style things. So we're waiting patiently. So hopefully, working with the National Community Development Association, they're really on top of it. They're trying to give us a heads up, but hopefully soon, and then the formula, and then we can figure that out of how much we'll get, and then we'll certainly let you all know.
All right. So, all right. So I think I will go ahead and make a motion that we adopt the recommendations as they appear, with one exception. Well, as they appear now on the screen. So the 30,000 for Equal Market Street is there. Contingencies down to 154. Staff will work with our partners to bring back a recommendation to us about spending the most effective and efficient way to spend that contingency. And we will see that in the next couple of months. So that is my motion.
Second.
All right, so we need to do a roll call vote. There is a motion and a second. Councilman Young?
Aye.
Councilwoman Smith?
Aye.
Aye. And I am also an aye. And I am, again, as always, I think it breaks my heart. I'm sure I speak for the rest of the committee for the groups that did not get fully funded or did not get any funding. I am very sorry. But we have other money coming, and my sincere hope is that you all will be able to avail yourselves of that funding. Okay, so I actually really do, I have to stop. So can we push the city-owned land conversation to our next meeting, Paul?
Oh, yes, absolutely.
Okay, and Nikki, I'm very sorry. You're doing great work. I know a little bit about it. I look forward to the conversation. And thanks for hanging in there on all of this. And next we have public comment. And do we have anybody in the speaker queue for public comment?
Councilman Mayfield, we do not have anyone for live comment.
Okay, great. Well, with that, we will adjourn this meeting. And again, thank you to everyone. Thanks for all the work that you are all doing in the community. So appreciated. Sorry, we're in just such a crisis, and you're all doing amazing work. And I wish we had a lot of money to give all of you. And also thanks to the staff for everything that you're doing. We will get through this. We will somehow.
Hey, Julie, can I connect you offline when you get free?
Yes, I will give you a call. And anything else that either one of you want to say before we adjourn?
Thank you to staff.
Yeah, thank you to staff and everyone who's committed to help undergird our community during these times. These are very hard times and sombering moments. And I wish we can do more and, satisfy every need. But, we kind of have to just pour ourselves and our resources into the most vulnerable. And I think that's what we've demonstrated today.
Yeah. And there needs to be more. Sorry, Brenda, go ahead.
I'm sorry. Somebody tapped just when I told you there was no comment. So we have one. If you want to hear it.
Sure.
Okay.
Connect them in.
Good afternoon. This is Kim Roney calling. And I just wanted to express gratitude to Paul and our staff. It really helps the way that you outline the information and how informed you are. I want to also express gratitude for our community partners doing this critical work, especially the words offered by Stephanie Swepson-Twitty. The pressure around this annual decision isn't new because we always have less funding in this pool than the requests that we have. So we have choices to make with our tax dollars. This is a time for a potential recommendation to move dollars towards investing in community, to invest in the requests, including intergenerational leadership by Black Asheville Demands. This recommendation could be finally getting real about repair and about what keeps us safe, investing in our Black business community and keeping our community housed and well. When we think about what is possible, please consider the $15 to $20 million line item request in the This Moment statement by CoThink. As we move towards repair, please consider when this item comes to full council to ask for general funds to be moved and to not wait. Thank you.
Thanks, Kim. I do think a lot of these issues are things that, as we start to shift our budget around in response to our reparations resolution and other community conversations, that we do need to be thinking about putting some general funds toward some of these initiatives and not relying on this very limited federal funding that we have that will likely only be more limited in the future. So that is definitely top of my mind as we move forward. All right, Brenda, anybody else in the queue?
We're done.
Okay, great. Thank you so much. Thank you, everyone. And we will see you next month, sorry. And Keith, I will give you a call. Thanks, everyone. Bye-bye.
Thank you.